Hello, my name is Dr. Marita Long and I'm a GP working at Glebe Hill Family Practice. So I'm going to talk to you today a little bit about contraception. And contraception is a really important topic for us all to get our heads around. Probably 2/3 of women at any point in time are using some form of contraceptive, and 85% of women are going to use one at some point in their life. And there are so many choices and there's lots of myths out there about contraception. So we'd like to be able to give you a little bit of an overall talk about how to make the best choice for you. So why is it so important? Actually, half of the pregnancies that we see are unplanned, which is quite unbelievable when you think about all the options out there for contraceptive. And it's really important that at the different ages and stages that you might be in, that we find the best contraceptive for you. So how do we make these decisions? So as I said, age is going to be something that's really important. So when you're 17 versus 27, 28 versus 40 going into those menopausal years, you're going to be looking for a different kind of contraception, and it might be that at different stages in your life you're really after the most effective form of contraception, as opposed to a time where if you were to get pregnant it wouldn't be a huge big deal. So also we have to take into account someone's medical history. So when we see a woman to talk about contraceptive, it's not just a matter of writing out that script for you. It really is about understanding your past medical history. And a really classic example of this is we wouldn't want to be prescribing the combined oral contraceptive pill to someone if they were suffering from migraines with auras, because that's an absolute contraindication. So taking someone's medical history into account is really important when we're choosing the right contraceptive for you. We also need to think about your preference. What do you like doing? What have your family members or friends done? That's something often that women will feel more comfortable with also. So we like to take time to explore what you know about contraceptive, what choices you know that are out there, and what you think might suit you the best as well. And then also, women will have had all sorts of different experiences with contraceptives. So you might have been on one particular pill, for example, that made your skin a lot worse and you wouldn't want to use that one again. Or it might be that you've reached a different stage, so where you've been on the pill and been really happy with that, you now know that you definitely don't want to risk falling pregnant, so you might want something that's a little bit more effective than the pill. So it's really important that when you book an appointment to talk about contraception, that you probably book a double appointment so we can take all these factors into account and find the best contraceptive for you. So when we think about contraception, there's lots of broad sort of categories, and I guess one of them is a hormonal form of contraception as opposed to one that doesn't have hormones in it. So for example, again going back to the stock standard combined oral contraceptive pill, that has 2 hormones in it, estrogen and progesterone, which are the hormones that are involved in our normal ovarian cycle and our menstrual cycles. But if you didn't like the idea of having hormones, or if you've got side effects for hormones, we can look at something without hormones, and that would be most classically the copper IUD. So that's one way of looking at hormonal versus non-hormonal. The other way of looking at contraceptives, I guess, is short-acting versus long-acting. So short-acting contraceptives are things like the pill. You take a pill every day, it works for that 24 hours that it's in your system, but then it stops working. And that's as opposed to a long-acting contraceptive. So something like the Implanon that we pop in the arm, or the IUD that sits in the uterus. And they're what we call long-acting contraceptives. That is, that they're in there and they're really a set and forget kind of contraceptive. So you're not relying on the individual to take something every day. Why are the long-acting reversible contraceptives so popular now? That's because they work really, really well. They have about a 99.7% rate of effectiveness. So that really means 1 in 1,000 women could potentially get pregnant using a long-acting, as opposed to the pill, which we know has about a 90% effective rate of effectiveness if it's taken as it's normally taken, not perfect use, because we know that in our busy lives, for a whole lot of reasons, we could be unwell when we're taking the pill, we could be busy and forget it, that it's not going to be the most effective choice. So as you can see, there's lots of different ways of looking at what sort of contraceptive might be the best for you, and that's some ways just a bit of a brief introduction, and we'll be doing some more videos around the particular types to give you a little bit more information about those as well.